meeting for June 2nd, 2016. I want to note that there are several appointments to be made, nominations from the governor. We have circulated sheets to everybody. We haven't had a chance to dissent on the nominations. This would include nominations to the Continuing Care Retirement Council, Council on Human Blood and Transfusion Service, Camp Safety Advisory Council, Minority Health Council, and the Administrative Review Board for the Office of Professional Conduct. So those are the nominations. First bill.
Senate Bill 817A authorizing bureau establishments to provide for the preparation, sale, service, distribution, or consumption of food and non-alcoholic beverages.
Discussion.
Oh, we have some amendments.
Amendments to keep everybody on board then.
Yes.
So that's one.
I think the one not written from central appointment.
Also Senator Golden.
One without rec, one nay, no discussion. Bill is reported. Senate 2847.
Requires the Department of Health to assign at least one investigator from the Bureau of Narcotics Enforcement to each borough of New York City.
Discussion. Bill is reported and it would go to finance. Savino, 5218.
Creates the Lupus Research Enhancement Program to fund and promote clinical research programs.
Discussion. Bill is reported. Senate 6314.
Authorizes attending nurse practitioners to execute orders not to resuscitate.
Just a quick question. I know this is your bill, that's why I'm asking you.
I'm hoping it's back in my head.
Up to this point, the authorization was only to a physician. Why are we giving this to nurses?
Well, because the rest of their scope of practice is to do what the physicians can do, and this was just completed. The second part of it is they're doing the course of treatment for somebody and are far better able to evaluate whether they're going to adhere to the DNR or not.
I voted without rec only because I wanted to ask a question and would remind you to ask. I guess I'm comfortable with it, but
Anytime we're dealing with end-of-life decisions, we never are really totally comfortable because it's end-of-life. But these are the things which the DNR has been in our statutes for 20 years, 30 years.
no, I recognize that. And you know, it's the kind of conversation people don't want to have with families and stuff like that, so most people don't really have a lot of this in place. I just was very curious as to why we were giving, moving this into the realm of nurses. Assuming that these are RNs again.
They're RN plus.
RN plus. Okay. Oh, you did say nurse practitioner, because I missed the plus. Yeah, okay, all right, then
Physician's assistants to do this.
I guess they're behind nurse practitioner.
Further discussion? Bill is moved for 6948. Cannon.
Provides
Oh, I'm sorry, Teller. Senator Felder voted nay on the prior bill. 6948.
provides for enhanced Medicaid rates to safety net hospitals.
Discussion? Bill is reported, and it will go to finance. 7050, SBI.
Requires the Department of Health to establish methods for notifying vendors of any reimbursement discrepancy.
Discussion? Bill is reported, it will also go to finance. Senate 7450.
Requires Medicaid coverage for blood testing for allergies.
Discussion? Bill is reported, again, finance. 7668, Senator Moore.
Requires OPWBD to prepare a report providing recommendations for providers that operate beneath a regional average, harmless from future rate reduction.
Discussion. Bill will be reported to finance. Senate 7853, Gallivan.
Prohibits the imposition of a fee for death certificates of inmates who die in custody.
Discussion. The bill will be reported to finance. Senate 7860, Amador.
Adds public libraries to the entities that can be an opioid antagonist recipient under the opioid overdose prevention program.
Who's doing the training?
People in the libraries, but it's, the amount of the training needed has diminished substantially now that it's become an aerosol spray. It may be we'll have to come back a little bit because there's adverse reactions by people who revived. So the administration is not it, but the people who are doing the reviving need to be warned that there can be adverse reactions. That would have to be across the board for everybody, and I don't know if we have enough time to do that, or we make it part of the package of heroin task forces that are negotiating. So the bill would be reported to finance, unless someone, discussion? Okay, the bill is reported. Senate 7881, Senator Krueger.
Provides that maternal depression screening and referrals performed by pediatricians shall be covered by the child's policy.
Discussion? Bill is reported. Thank you very much.
Great meeting, Mr. Chairman.
If you sign the sheet, the nomination sheets are appreciated. There may be a meeting in the future, not for the purpose of bills, but